studying or at least having a background of bloodborne pathogen is to protect everyone. We need to minimize and eliminate exposure to disease-carrying microorganisms or pathogens that can be found on the human blood or other body fluids. Remember, permanent makeup involves touching blood, involves needles. So this is a very important thing that we need to understand. We need to know the concepts that we have to adhere to when we're in school or work or in your practice area. You have to have that control. You have to have protective equipment. What are you supposed to do if you got an exposure and things like that? So this is the purpose of this thing that we're going to study right now. So there is what we call a chain of infection. So in order for a person to get infected, all the factors in the chain has to be present. There has to be a pathogen, a disease, a blood-borne disease from the source. So the source person should have a way to exit. Like, how will the source leave the body of the person? The exit way might be a cough or sneezing, and then it will be spread through the air or to the material that the person coughed into and you accidentally touched it, like a door. If somebody sneezed on the door or sneezed on their hand and touched the doorknob and you accidentally touch it, then that's your mode of spread. Then how will it enter your body? There has to be a way to enter the body. Can be through your mucous membranes like your nose, mouth, or eyes. Okay? And then the person has to be at risk. What type of people are at risk? The person must have susceptibility to the pathogen, like a weakened immune system or a pre-existing condition. So most likely this person is at risk because of the low immunity, and then the pathogen will overwhelm that person's immunity, thereby making the person sick. But this four criteria or this criterias, if we eliminate one of the links, the infection will be reduced. Let's say there is no way of entry. You're fully covered during your procedure. So even though there is a source of the pathogen, since you're fully covered, it will not enter your body. So once we eliminate one thing, the person will not get infected. Okay? So there are three most concerning blood pathogens. So these three are hepatitis B virus or HBV, the hepatitis C virus or HCV, and the human immunodeficiency virus or the HIV, the virus that causes AIDS. Okay? There are other recognizable blood pathogens like syphilis or Ebola and or hemorrhagic fever. Yeah, so there are other pathogens, but the three specific blood-borne pathogen that we will be discussing are the top three. Okay, just a warning. Okay, not all blood-borne pathogens are contagious to some degree, nor do they have symptoms. So people can come into your shop, you think they're healthy, but you don't know that they've had previous hepatitis B disease and it stays in the body. Okay, so some people can be infected and contagious, but they show no symptoms. All can be caused by blood-borne pathogen transmission, but only a few have available vaccine or cure. So make sure you protect yourself. That's the best way to avoid this. Okay? To continue your business, you have to protect yourself. Okay, so let's start with the human immunodeficiency virus or the HIV. Okay, so HIV causes the infection AIDS, okay, or the acquired immunodeficiency syndrome. The virus attacks and suppresses the immune system. So it specifically targets the cells that are crucial for fighting infection from invading organisms. This allows other diseases and infection to progress in the body without resistance. So let's say a person gets pneumonia while already suffering from HIV virus, then this could be the cause of the death of the person. Okay, so is it transmitted? It basically, the reason why we're studying this is because it can be transmitted by blood. It can also be transmitted by sexual intercourse or vaginal fluids. And those that are infected may not even show any symptom for a long time but can already infect others. Okay, so some who has symptoms could be swollen or lymph nodes, they have fever, they have unexplained rashes in the body, their muscles are aching like they have rheumatism, they have chills, fatigue, mouth ulcers, night sweats. These are just some of the symptoms of HIV, but again, they might not be showing any of this for a long time and they could still be infected. Okay, so HIV compared to HBV or HCV poses a shorter risk of exposure because HIV is very fragile and can only survive on air or outside the human body for a few minutes. So it dies when it no longer when it no longer is on the body. So if blood drops on top of the table and you sanitize it well, then most likely you will not get infected. Okay, but if you puncture yourself during the procedure, we will be discussing later on the following slides what you're supposed to do. Okay? Hepatitis. There are two kinds. There's Hep B and Hep C. Both these viruses affect the liver. Okay, so hepatitis B is a virus that makes the liver inflamed. And if it is acute infection, the person is exposed to the virus and can develop over time, and the virus remains in the body. It can be life threatening because there will be complications from hepatitis B, including cirrhosis, meaning inflammation of the liver or degeneration of the liver cancer, or liver failure. So, hepatitis B is serious business, but we can protect ourselves. So, hepatitis C, on the other hand, can cause also severe liver damage, very similar to HPV. Both can be acute or sudden or long-term infections. Most people with HPV infection do not display symptoms. When they do occur, they include the same symptoms that occur with HPV. And these symptoms would include fever, fatigue, loss of appetite, nausea, vomiting, dark urine, clay-colored bowel movements, joint pain, and jaundice or yellow color of the skin and the eyes. Okay, so hepatitis. This is actually the yellow color on the skin is a giveaway symptom of hepatitis. Okay, so there is immunization for hepatitis B. Okay, so you can protect yourselves. You can ask your medical practitioner if to give you a hepatitis B vaccine because this will protect you in the long run because you will be exposed to blood. Mostly, this vaccine has already been given during childhood. So most likely you're already protected against HBV, but it is still safe to ask your medical practitioner. Okay? There are tests for you to know if you already have the immunity to hepatitis B. Okay. Unfortunately, hepatitis C has no immunization available, but treatment is available for acute infection that can reduce the risk of disease becoming chronic. However, there's uncertainty about the treatment when it should be started. So, again, the best way is to protect yourself. Okay? Right. So, let's go to method. How are you going to protect yourself? We have a separate lecture for protecting yourself in your workplace. But quickly, basically, you have to have a biohazard sign or label to where you're throwing your dangerous materials. For example, your needles, your gloves. So if you throw your biohazard trash, the trash should have a sign that says it's a biohazard, and this is usually labeled orange with black. That the biohazard sign um, is usually orange or orange red background with the black biohazard symbol. Okay, this is easy to research on the internet, and there are bags that are already available for this. Okay, so for your needles, definitely you need to have a sharps container. Ask your supplier of permanent makeup products, because this container is where you're supposed to throw used or blood contaminated needles. It should be leak proof, it should be labeled and color coded, so it should there shouldn't be spills. Okay, so you can also, just in case there are broken glassware where you're working, you can also put your broken glassware there, but please do not use your hands. Use a forceps, use a tongue or brush or dustpan. Never use your hands even though you're wearing gloves. Okay, protect yourself. So definitely you should wear personal protective equipment, and again we're going to discuss that in the next lecture. Okay. Your knobs in your work areas, doorknobs should also be clean, because people keep holding them. Okay, if you already are wearing your gloves and you need to touch your eyes or nose or mouth, you need to wash them. I mean, remove your gloves, wash your hands before touching anything. Okay, if you need to go to the restroom, you need to change your gloves before coming back to your work area, just in case exposure occurs by accident. What are you supposed to do? Okay, so if it occurs or if it happens, you have to care take care of the wound right away. Let's say you're working on a client and you accidentally poke yourself with a needle, or your workmate with a needle. Okay, if it creates an open wound, definitely wash and irrigate the wound well. Put lots of soap and lots of running water on the wound. If you suspect an exposure from potentially contaminated materials to the eyes or nose, you also have to flush it with large amount of running water. If potentially contaminated material gets into non-intact skin, meaning if you already have a wound and contamination entered it, then again, you have to wash it with soap and water. Okay, have to rub it vigorously as soon as possible. Okay, so it is best that if you are doing procedures that involve blood, you have to have a hand washing facility. It is very important. If you don't have it, you have to have strong antiseptic available. Okay, so recommended usually 70 to 80% alcohol or the equivalent. Okay, so what happens after you wash? Of course, you have to see a doctor and tell the doctor what happened to you. Share your experience, because the doctor would know what type of test he or she should have you take. Okay, so and then the doctor will tell you, or your medical practitioner will tell you what test to take, and after the test, what immediate care you can do. And then after that, if you can still get the vaccination, or they will also interview you, who else got the exposure, so that everyone will be protected or will receive care. Okay, so most some exposures to blood pathogens or this viruses already has prophylaxis, or so they can give you uh, the prophylaxis, give you proper counseling and management. Okay, so make sure to see a doctor right away and listen to the next lecture on how else you can protect yourself from bloodborne pathogen or other infections in your workplace.